Hello, Shemai. My name is Jake Smith. I'm the Policy Officer for Carers Wales, the national campaigning charity for unpaid carers. And I'm here to talk you through this presentation, Physical Activity and Unpaid Carers, as part of a MeTime online support session for those who were unable to attend on the 11th of April. Why physical activity matters to carers. Across Wales, hundreds of thousands of unpaid carers are looking after people who need care and support due to age, illness, disability, or because of a mental health condition. The efforts of unpaid carers save Wales billions of pounds every single year, so their health and their well-being matters immensely to everyone. Unpaid carers often report multiple physical health problems, including fatigue, musculoskeletal disorders, arthritis, and long-term back problems, particularly if they're involved in lifting their loved one or operating equipment in the home. In 2021, Public Health Wales conducted a study comparing the health of carers to that of people who don't have caring responsibilities. And their research found that unpaid carers are in poorer health than the overall population, even controlling for socio-economic factors, with Public Health Wales finding that unpaid carers have higher rates of 36 out of 37 long-term health conditions. And these findings are very much reflected in our own research. The Carers Wales State of Caring Survey 2022, conducted in late 2022, found that 34% of unpaid carers in Wales reported that their mental health was bad or very bad, and close to a quarter, 24%, said the same about their physical health, describing it as bad or very bad. If unpaid carers are in poor health, if they are struggling, and if they are severely limited in their ability to provide care, that risks the continuation of their immensely important role. It risks carers being unable to care, as well as the unacceptable price of unpaid carers themselves seeing their health deteriorate because of their caring responsibilities. It's so important for everyone that unpaid carers are supported and given support to become more physically active so they can reap the health benefits and look after their own health and well-being, whilst they look after some of the most vulnerable people in society. It's widely accepted that being physically active is very important to maintaining a healthy lifestyle. Being physically active assists with the maintenance of a healthy weight. It improves sleep. It helps with managing stress. It makes a huge contribution to the maintenance of personal well-being, physical health, and mental health. And that's why the UK Chief Medical Officer recommends that every adult undertakes 150 minutes of moderate physical activity or 75 minutes of vigorous physical activity every week. Unfortunately, there is much evidence to suggest that unpaid carers are struggling to be physically active, with high levels of inactivity. In the State of Caring 2022 survey conducted in Wales, 68% of carers, nearly 7 in 10, said that they had done no vigorous activity in the previous week, and 4 in 10 said they hadn't done any moderate physical activity in the previous week. Concerningly, it also appeared that the situation might be deteriorating. Nearly half of carers in Wales, 47%, said that they were less active. They had become less active in the previous 6 months, with a far smaller proportion, just 13%, saying that they had become more physically active. But we know that unpaid carers want to become more physically active. A study conducted by Carers UK amongst carers over the age of 55 in England found that over 7 in 10 say that physical activity makes them feel good about themselves, but a similar proportion, over 7 in 10, saying that they're not able to do as much exercise as they would wish. So why is it that unpaid carers want to be more physically active, but so many appear to struggle to do so? A leading factor is the barrier of time and energy, having not enough time or energy to become more physically active. 7 in 10 carers in Wales told us that they simply don't have the time or the energy to become more physically active or to make use of their local leisure facilities. Caring roles can be incredibly intense, with many people caring around the clock, providing vital support to their loved ones. Because of this, many carers tell us that it's so difficult to have any time to themselves, and it can be nearly impossible to have a break to look after their own health and well-being. This means that the time available to engage in physical activity is severely constricted for many unpaid carers. But even when unpaid carers might be able to have some time off and have some time to themselves, other things might be prioritized, even something as simple as catching up on sleep, or maybe essential household maintenance, other things that have been put off amidst the extreme demands of many caring roles. So this means that physical activity and engaging in exercise can fall off and not be prioritized. There is also much evidence to suggest that carers with the most intense caring responsibilities are most likely to have high levels of inactivity, with research suggesting that particularly amongst those who are caring for over 50 hours a week, there are higher levels of inactivity compared to carers with less intense caring roles. And this is particularly relevant in the Welsh context, with the 2021 census finding that 107,000 people in Wales alone care for over 50 hours a week. And this was a higher proportion in Wales compared to in England. So not only do many carers struggle to find enough time and have enough energy to become more physically active, we know that a substantial proportion of carers actually have some of the most intense caring responsibilities in Wales, and therefore face additional barriers around a lack of time and a lack of energy to becoming more physically active. Another barrier to physical activity is financial pressures, with many carers feeling they simply cannot afford to become more physically active. More of those who are struggling to make ends meet say that they have been less active in the previous 6 months, 62%, compared to a still substantial, but nonetheless lower, 47% who said the same of carers who are not struggling to make ends meet. And indeed, 45% of all carers in Wales told us that their local leisure facilities are just too expensive. And this barrier can be particularly significant for unpaid carers, because we know that unpaid carers are particularly exposed to the present cost of living crisis. Unpaid carers face many additional costs that are not borne by most people. Carers might have to pay for higher heating bills to ensure the home is consistently heated to a temperature appropriate to the condition of the person they look after. They might have higher food bills through the purchase of specialist or limited range of food. They will often face higher transport costs by transporting a loved one to frequent GP's appointments and doctor's appointments and checkups. They might have to pay for equipment out of their own pocket or adaptations in the home. Because of all of those factors, unpaid carers are particularly exposed to the present cost of living crisis. But it also shows why many carers will feel that finances and a lack of money presents another barrier to physical activity. A further barrier to physical activity faced by carers is poor health. So, as we discussed a few minutes ago, Public Health Wales have found that unpaid carers are in poorer health than the population at large. And similarly, in our State of Caring 2022 survey, 51% of carers in bad or very bad physical health said that they had done no physical activity in the previous week, compared to 29% of carers who described their health as good or very good. So we know that carers in general are in poorer health than the wider population, but we also know that amongst carers, those in particularly poor health can find it even more difficult to become more physically active and to exercise at the same time as having to contend with life-limiting illnesses or disabilities of their own. Things that might make exercise more painful or impossible, such as arthritis or back problems. On a more positive note, it is widely acknowledged that more needs to be done to support carers to be more physically active, and there is much support out there. All across Wales, many counties and many local authorities offer discounted or free membership of local leisure and exercise facilities to unpaid carers. In Pembrokeshire, carers are offered a free 6-month membership of local leisure facilities, getting them discounted access to things like fitness classes and health checks. In Monmouthshire, carers can access a 25% discount to local authority supported leisure facilities. In Powys and in Ceredigion, carers can access a discount for leisure services with an iCare card. In Bridgend, Halo Leisure offer discounted membership to their facilities, enabling carers to access things like guided exercise sessions and nutrition and diet advice more cheaply than they otherwise could. And in Newport, over the last year, the County Council have been funding 1-year memberships of Newport Live, the local network of leisure facilities for carers in receipt of a grant. But in addition to discounted and free membership to facilities, it's worth noting that all across Wales, councils, carer centres and third sector organisations and others are organising dedicated sessions to help carers to become more physically active. Bridgend Carer Centre, for example, organises monthly walks and weekly Zumba sessions for carers in the county. In Ynys Môn, their dementia active exercise sessions are all open to unpaid carers, so they can enjoy things like swimming classes alongside the person that they look after. In Monmouthshire, the council organises guided walks for unpaid carers and football sessions for young carers. Whilst in Pembrokeshire, carers can access walk and talk sessions, helping carers to get out and about and also to meet and socialise with other unpaid carers. Another way to be physically active is, of course, to visit and explore many of the amazing historical sites that we have in Wales. Cadw, which maintains many of the historical sites, offers all disabled people free access to their sites and they can bring with them an assistant or a companion for free as well. So this is something that many unpaid carers will be able to take advantage of if they are planning a day out with the person that they look after. So it can be a great way to explore somewhere new and get active as you see a historical site. But if you're not able to get out and about and have to remain in the home for extended periods, it might be worth looking into whether support could be put in place through equipment to enable you to exercise in your own home or the home of the person that you look after. Under the Social Services and Wellbeing Act, carers' needs assessments have to consider the well-being of carers, and they have to consider whether support should be put in place to enable carers to look after their own well-being and continue to provide care. All carers have an entitlement to a carer's needs assessment. So when you are having a carer's needs assessment, or if you request a new one, as is your right, it's worth discussing whether the local authority could provide you with home exercise equipment to help you to be physically active and look after your well-being in your own home. This month is Carers Active April, a campaign run by Carers Wales and Carers UK to talk about the barriers that carers face with regards to physical activity, but also to look at tips and practical steps that can be taken to integrate more physical activity into the daily lives of carers. As a result, we in Carers Wales have organised free walks taking place all over Wales on the 21st of April. So please join us either at Flint Castle in Llandudno or in Butte Park in Cardiff on the 21st of April. It'd be a great opportunity to meet other carers and Carers Wales staff and volunteers, and hopefully we'll have a lovely walk in the sunshine. If you'd like to find out more, please look at the Carers Wales social media accounts, our website, or send us an email. Throughout the year, Carers UK and Carers Wales provide a Carers Active Hub, which has a range of information on becoming more physically active. It contains, for example, expert advice from fitness professionals on how to integrate more physical activity, more exercise into your day-to-day. It has health information, activity ideas, and case studies from carers who have been able to become more physically active alongside their caring role. So if you'd like to find out some more information, get some expert advice, and hopefully some inspiration, please take a look at the Carers Active Hub, which you can find on the Carers Wales and Carers UK website. But throughout the year, we also provide support to carers to become more physically active through our MeTime online support sessions. Our MeTime online support sessions offer a range of regular activities for carers to come together and socialise, and that includes everything from guest talks through to arts and craft, but it also includes things related to physical activity, such as Drew yoga and Zumba classes. So keep an eye on our upcoming online wellbeing support sessions for our MeTime programme to see whether there's things that you can do in your own home with other carers to become more physically active. And you can find all of our upcoming sessions on our website. Diolch, and thank you very much for listening to this presentation. Please visit carerswales.org to find out about our resources and our upcoming events. Please contact us at info@carerswales.org if you'd like to find out about anything that we talked about today, or any of the services and information and advice that we offer to unpaid carers. You can also follow us on Facebook, Twitter, and LinkedIn, where we'll be posting more information, particularly throughout the month of Carers Active April, on becoming more physically active and the support available to do so.